watoto wote mpande juu, walimu wenu wanawaongojea watoto wote kwa utaratibu bila kukimbia. Uchaguzi namba 102. Mlangoni pa moyo, mlangoni pa moyo. Ready? 102, 102. 102. Mlangoni. Pianist. Tuimbe kwa furaha. Twende. Stanza 3, nasikia sijui ni kelele iko juu, punguza kidogo nisikie wakiimba. Stanza 3. Usikie sauti. Usikie. Mitambo imekuwa sawa? Iko sawa? Haya, tuachie hapo, aendelee. Karibu mgeni.
Good afternoon. Happy Sabbath. Happy day. Happy Sabbath. Happy day. Yeah. Mumeshinda aje? Happy New Year. Mumeshinda aje? Kila mtu ameshinda salama? Are we 100% sure? Sisi sote tumeshinda salama? Very good, very good. Sasa siku hii ya leo, once again happy Sabbath. So kwa majina naitwa Mogaka Nyaben Junior. Senior ndio huyo amekaa hapo nyuma. So yeye ndio senior, alafu mama ako hapo. You met my sisters earlier in the morning, and I would want to say it's a privilege standing before the Isili fraternity, Isili SDA Church fraternity, sorry. Mtaniwia radhi, nitatumia lugha zote, ya Kiswahili, ya Kisii, ikiwezekana, ya Kizungu, ndio tuweze kuelewana vizuri. Sawa sawa? Lakini I promise you sitatumia Kisii sana, juu hata pia mimi sielewi vizuri. Lakini ile kidogo tutajaribu, tutajadiliana, si ndio? So, my role here is not to teach. My role here is to discuss. Si ndio? Wale wa kufundisha walikuwa asubuhi na walifunza, si ndio? Wangapi walipata kitu kutoka kwa leseni ya asubuhi? Kwa sababu for sure nitaongeza tu kitu kidogo kwa Kenya walisema asubuhi. Kidogo hivi sana. Sawa sawa? Alafu I promise to take the shortest time possible, alafu tuendelee kudiscuss. Sindio? Sindio? Sio tuko pamoja? First and foremost, I would like to thank the ECLE administration for actually granting me this opportunity to stand in front of you. It's not any ordinary thing, especially this time of the season. Na nataka kuwapa the administration asanti sana. And at large, I would like to thank Metrin. Tumekimbizana for some time, tukapatana. Once again, thank you very much for granting me this opportunity. Again, I would like to thank my brother who stood here before me. It was such a great way of starting the afternoon. Sindio? Nataka kumshukuru kwa hayo pia. We will bow down for a word of prayer kabla tuanze vizuri. Sindio? All right, tuombe. Baba yetu aliye juu mbinguni, twaja mbele zako wakati wa mchana tukikurudisha shukrani kwa kutulinda tangu asubuhi hadi sasa. Asanti kwa yale yote umetutendea mpaka wakati huu. Tutakavyoenda kujadiliana na wana wako wakati huu wa mchana, tunakuomba uwe kati yetu, utusaidie ili tuweze kuelewa, na chochote tutakachokuwa tukisema kiwe kwa kutukuza. Kwa hayo yote naomba kwa kupitia jina la Yesu aliye mkombozi wetu. So, in the morning we discussed health. At least there was an insight. Tuliambiwa kitu, tuliambiwa afya, tuliambiwa juu ya afya. Metrin alituanzishia hapa akatuambia afya ni nini. Then wahuduma wa mchana pia wakakuja wakatuambia afya ni nini. Up to now, wangapi at least wameelewa afya ni nini? At least something, even one thing. You've understood what health means. Obe, hakuna? All right. Very good. At least we have one or two people. That's a good thing. Now, sasa I will just put a little bit emphasis on what health is. Health. What is health? Mara mingi tumetumia masimu, wengine wetu tumesoma, we've interacted with this word called health. But most of us who haven't gotten the privilege of knowing what health is, we know tunajua health, kukuwa na afya mzuri ni kukuwa physically okay. Si ndio? Si wengi tunajua hivyo? Yes, that is true. It is actually very true. But health per se, it doesn't necessarily mean you are physically okay. Si ndio? Health as a word, it subdivided into different other parameters. To be healthy, you have to be spiritually fit. Kama sai, most of us, I know, tuko hapa kwa kanisa so that we be spiritually what? Fit, spiritually nourished. Physically, wengi wetu pia we do one or two things to be physically fit. Mentally, wengi wetu pia at the same time we do one or two things to be mentally. Na hiyo ingine ilikuwa gani? Sorry? Socially. Okay, thank you very much. Yes, so health as a word contains all that in general. Sawa sawa. So it is very, very important for us to have good health. Number one, and again another thing from the scriptures we read earlier today, mwili yetu, we are the temple of who? So it is our responsibility. It is the only job we have, by the way, from the scientific point of view and the medical point. It is the only job. The only job Mungu ametupatia. Kufanya nini? We look after ourselves. Si ndio? But are we really doing that? That is one of the questions we should ask ourselves by the time tufanye nini, tumalize hii sermon, si ndio? Okay, it's not a sermon, sorry, this discussion. Sawa sawa. So that brief introduction about health is basically, that is all about health. You need to be spiritually fit, mentally fit, physically fit, socially fit. If one of the four is amiss, hiyo inamaanisha tumelegea mahali, and we have to pull up our socks kufanya nini, kuitengeneza, si ndio? So we will discuss a few things concerning our health, and most commonly some of the conditions that affect us on a day-to-day basis, si ndio? Because hizo ndo vitu zinatupea changamoto kwa nini, kwa maisha yetu. Once again, I will try as much as possible tufanye nini, sote tuelewane, si ndio? Na wakati unaona nimeenda mbali kidogo, na niambia Mr. Boss, tafadhali turudishe nyuma kidogo, sawa sawa? Aya, very good. So like I said, it's an interactive session, one of you from the I'll just be posing questions, then someone raises their hand, alafu tunafanya nini, tunajibu tukiendelea, si ndio? What are some of the conditions that affect us on a day-to-day activity? Like very common, obvious conditions. Me, I'll say one, homa. Hiyo inatu affect sana. True, false? Hiyo ikituweka chini ime interfere na physical health yetu, si ndio? And we really need to do what? We really need to be healthy. So that imefanya nini? It has affected our health. Hiyo ni afya, si ndio? Another one, any health, I mean any day-to-day condition, kitu yoyote. Sorry? Headache. Very good. Headache interferes with your day-to-day activities. Another condition, kitu yoyote. Yes, ma'am. Sorry? Kuumwa na miguu. Very good. Another one, stomach. Ukiumwa na tumbo, saa zingine hata you might not even function, for your information. Another one, yes, ma'am. Dizziness. Dizziness. These are good answers. Another condition, yes. Njaa. Njaa. Ukweli, ukiwa na njaa, you might not even think very well. Huwezi fikiria vizuri, si ndio? Another one, two last. Yes. Sorry? Stress. That's a very important. I will put a little bit of emphasis on that. Stress. Very important point. Last one. Yeah, yote tu. Yes. Meno. Very, very good. Now, all those are good answers. Very good answers. Then today, I will introduce, apart from my homa and headaches and stress, I will introduce to you another topic. A very common topic. Okay, maybe one, maybe two, maybe three topics, but we will discuss. And again, with the shortest time possible. Sawa sawa. There's a condition called pressure. Wangapi wanajua pressure? Tunajua pressure. Wangapi wamesikia pressure? Imetuchanganya sisi for the longest of time, si ndio? Once again, it is a what? It is a discussion. Si ndio? Pressure ni nini? Pressure ni nini? Mtu mmoja tu peke yake. Pressure, nani amesikia pressure ni nini? Pressure. Kitu tu yoyote. Yes. Force interfering with your health. Force doing what? Interfering with your health. Very true. I will tell you why. Let me give you an example of let me give you an example of taps. Si tunajua taps za maji, right? assuming we have two types of taps. Kuna ile tap ya tuseme kama ile ya kuosha vyombo, ile iko huko kwa kitchen, si we know it, eh? And then we have, let's say we have two similar taps, eh? But one has a bigger valve, has a bigger opening, sorry, than the other. Alafu tuzifungue zote. One has a small opening, another one has a big opening. Tuko pamoja hadi hapo? Kati ya hizo taps mbili za kuosha vyombo, gani ndio itakuwa na pressure mingi? Hiyo kubwa. Wangapi wa hiyo kubwa? Wangapi wa kubwa? Tuko na taps mbili, tunafungua maji, si ndio? Tap moja, thank you very much. Tap moja iko na opening ndogo. Tuseme this. Mnanisikia? This is the size of the bigger opening, yeah? Hii kubwa hii. Then alafu hiyo ingine ni ndogo. Which one do you think will have high pressure? Ni gani itakuwa na pressure mingi? Wale wakubwa? The small one. Wale wa small one? Wale wa the big one? Brilliant. So, the small opening will have high pressure. Sindio? Now, it's actually the same thing we talk about when we discuss health. When we talk about pressure, pressure does not only affect pressure ya maji, pressure ya stima, pressure ya all that, it also affects our health. Sawa sawa? How does this come about? Kwa miili yetu tuko na vitu vinaitwa mishipa. Mishipa are called vessels in English. When these vessels are dilated meaning zikiwa kubwa, pressure inakuwa nini? Inakuwa ndogo. Lakini hizi mishipa zikikuwa ndogo, pressure inafanya nini? Inaongezeka. Tunaelewana? Na pressure ikiongezeka inapita kwa mwili haraka. As a result, tunaita nini? Pressure. Tumeelewana hadi hapo? Tumeelewana hadi hapo? Very good. Now, let's dig a little bit deeper. Now, pressure in this context, in our context here, remember we are discussing the common diseases that affect our lifestyle. Other than what we've done, what we've mentioned. Pressure, this is what I want us to focus on. Kidogo tu, for about 10-15 minutes. Sawa sawa? So, most of us tumeenda kwa hospitali, ukiingia huko on the triage wanakuambia let's tupime pressure, tuangalie pressure yako iko ngapi. Si tumefanyiwa hivyo, si ndio? And there's a certain machine wanatumia, wanaweka kwa mkono, wengine wanaweka, back in the days walikuwa wanaweka mashine hapa na wanatumia ile kitu ya kusikiza masikio. Si tunaijua hiyo? It's called a stethoscope. Wanaisikizia, wanaweka nayo ndio nasikiza pressure. Sio tulikuwa tunaijua hiyo yote. So most of the time tunafinywa hiyo pressure, unaambiwa mom, dad, mzee, pressure yako iko hivi, iko juu, iko chini. Si tumeambiwa hivyo wakati mwingi? Now I want us to mention briefly the normal pressures. The normal, we define the normal and the abnormal. Sindo? Sawa sawa? Quickly, I'll take you through that. Kama tuna mahali pa kuandika tutaandika. Then I will elaborate. Sawa sawa? So, tukiangalia in different literature, vitabu, kwa internet, mtapatiwa different values. So I will give you the WHO values. So the normal temperatures, there is the optimal. We will divide them into 5 groups. Sawa sawa? 5. We have optimal, we have normal, we have high normal, we have grade 1, grade 2, and grade 3. Sawa sawa. Optimal pressure rather ni pressure iko between 120/80 and below. Tuko pamoja hapo? That is optimal. It is not bad. Optimal inamaanisha iko nini? Iko sawa. The normal pressure, naomba msamaha. Hiyo temperature, pressure na pole. The normal pressure is between 130/85 and below. Sawa sawa. That is the normal. Higher normal is 140/90 and below. So between 130 and 140 and between 85 and 90, anything below that, it is higher normal. Nitawaambia hiyo 130/85 inamaanisha nini. Sawa sawa. Tuandike hiyo kwanza. Then we have grade 1. Grade 1. Tumekumbuka ile nikiwaambia ile type iko na valve ndogo inatoa pressure nyingi. This is the same thing we are seeing here. When our pressure rises, we again categorize them into different grades. Grade 1 of high pressure, it's any pressure below 160. Tuko pamoja? Below 160/100. So anything between 140/90 and 160/100 is grade 1. Sawa sawa. Then there is grade 2, where we have 180/100 and below. Grade 1 ilikuwa ngapi? 160/100 and below. Sawa sawa. Grade 2, 180/110 and below. Hapo tuko pamoja? Now grade 3 is anything above 180/110. Tuko pamoja? Tumepata hizo grades 3. So take home notes kwa easy values. We know the normal and we know what is not normal. Sawa sawa. We've defined the normal and what is not the normal. Si tumepata hizo values. Now hizi values hapa, hii unasikia 120 na 1/80. What are they? 120 is what we call the systolic pressure, and hii ya chini 80 is called the diastolic pressure. What does this mean? The systolic pressure means pushing, like to contract. When the vessels when muscles in the body contract, there's pressure, there's increased in pressure, especially in our vessels. So when there is blood ikiflow kwa mishipa, hiyo contraction is what we call the systole. Ile inatoa damu kutoka kwa nini? Kwa heart chambers. Sawa sawa. Then the diastole means to relax. Sawa sawa. So there is also that pressure. Wakati damu imefanya nini? Iko ina relax, yani imetulia tu. Now when we are taking pressure, we check both parameters, systolic and diastolic. Ile ya kusukuma na ile ya kufanya nini? Tunaelewana hadi hapo? Tafadhali kama naenda mtu aelewi, onyesha tu mkono tusaidiane, si ndio? We've understood up to there, si ndio? So those are the normal and the abnormal pressure values. Tumeelewana hadi hapo? Very good. So hii pressure yenye tunaongelea hapa inasababishwa na nini? Nini ndio inasababisha kila wakati tukienda hospitali daktari anatuambia pressure iko juu, mara pressure iko chini? There are so many factors that cause increased pressures. We have I've categorized them into different topics, different parameters. The most common, one of the parameters rather, tutaanza na genetics. Tunajua maana ya genetics? Yani iko inherited, iko kwa familia. Tunaelewa hiyo? Iko kwa familia. It is one of the risk factors for getting high pressure. Sawa sawa. Number one ni genetics. Kwamba kama kuna mtu wazazi wetu, kuna mtu anyone in the lineage hiyo familia alikuwa na pressure, chances are pia the offspring wanaweza fanya nini? Wanaweza pata. Another factor is environmental. I'll just be broad, sitaguzia zile, I'll just talk about the common ones. Sawa sawa. Environmental causes. What are some of the environmental causes? Tuliongea asubuhi things to do. Dada yangu Esther aliongea juu ya, okay, wote waliongea juu ya increased weight, chakula. Tunakumbuka hizo. So some of the environmental causes of increased pressure: obesity. Remember what we are discussing is lifestyle diseases. Obesity. Is obesity a lifestyle condition? Let me call it a condition. Is it? It is. Very good. Obesity inamaanisha wale watu wako wamenenepa, si ndio? We have other things. Gladly enough, as Adventists, we don't indulge to drugs. Madawa, drugs, mihadarati. In this context, we talk of alcohol and smoking. These are lifestyle issues. Zina to affect sisi. And by the way, just a note, you don't need to be an active smoker to be a smoker. What do I mean? Si lazima ushike sigara uvute sigara tuseme wewe unavuta nini? You can be a passive smoker. How? Ukikaa mahali watu wanavuta sigara wengi, unafanya nini? You are a passive smoker. Tumeelewana hapo? So is in that environmental. That affects our environment. It affects our health. As a result, it interferes with our health. It is a cause of increased pressure. Tumepatana hadi hapo. Ndugu yangu aliongea juu ya stress. Stress, especially hii maisha tunaishi sahi. Kama kuna mtu hana stress, tafadhali inua mkono and we will clap for you and we will congratulate you. All of us are stressed. Wengine tuko kanisani hapa, tunafikiria leo nitakula nini? Tunafikiria watoto watakula nini? COVID imeharibu maneno, sina kazi. Tuko kanisani, kumbuka nitafika aje nyumbani? Huyu jamaa atamaliza saa ngapi aende? Niende nikafikirie venye nitapata. You see, that is stress already. And stress interferes with health. And remember, health, tulisema you don't necessarily need to be physically fit. You also need to be mentally and psychologically fit. So, umeona, stress too can contribute to increased pressure. Tumepata hizo? Let's focus on that for now. Those are what we call primary causes. Sawa sawa. Those are some of the primary causes. Then we have secondary causes. Secondary causes za pressure ina include vitu kama madawa zile dada yangu anatengeneza huko mahali anatengeneza. Hizi madawa venye na alituambia si madawa mzuri, si alituambia si mzuri. Haya madawa, kuna kategori fulani ya madawa yanaweza changia kufanya nini? Kuongeza pressure kwa mwili. Tunakuwa na pressure. Other than hayo madawa, kuna conditions zingine za kimwili tuko nazo zinaweza fanya nini? Zinaweza ongeza pressure kwa mwili. Tuko pamoja hadi hapo? Tuko pamoja? Now, these are some of what we call secondary causes. We have other conditions. Kwa mfano kama uko na shida ya kidney, shida ya heart, ya roho. These are some of the conditions, especially kidneys. I will tell you more about the kidneys. This can cause increased pressure. Sawa sawa? Tuko pamoja hadi hapo? Mtu yote amelala darasani? We can wait for you. Bado train haijaenda. Tuko pamoja? Very good. So, tusha discuss what could be causing pressures. Now, if anybody has an addition, please jot it down. We will discuss it. Now, what are some of the clinical findings, clinical features? Yani, utajuaji mtu ako na shida ya pressure. As in, utamwona tu huyu, utapresent aje kwa kliniki yangu, utapresent aje kwa hospitali. Some of the clinical features, 2 minutes, kitu tu yoyote, anybody. Again, it's an interactive session. I am not going to teach. Yes. Anakuwa very emotional, very good, very emotional, very emotional. That is one. Number 2, yes, headaches. These are some of the things that interfere with our day-to-day activities. It interferes with our health. Si tulisema hiyo tukianza session, si ndio? Another one, kitu tu yoyote, anything else. Yes. Sorry? Fatigue, kuchoka. These are some of the symptoms of increased pressures. Headaches, fatigue. Another one, yoyote tu, tuseme tu yoyote. You see, you know them. There is what we call palpitations. Nani wamesha kumbana na hiyo jina mahali? Palpitations ni wakati moyo unafanya nini? Unagonga haraka. These are some of the signs and symptoms of increased pressure. Palpitations, headaches, sweating a lot, unashikwa na kizunguzungu, you're feeling dizzy, unasikia kuchoka. Yani, all these things. Note, let me make a note here. Having all these things, it doesn't necessarily mean you have pressure. Sawa. These are some of the signs and symptoms of increased pressure. But having these symptoms doesn't necessarily mean uko na nini? Hapo tumeelewana? Yes. Another symptoms include vision blurriness, yani kutoona vizuri. There are so many. Sawa. So these are some of the clinical features. And sometimes unaweza kuwa na pressure iko juu and you have no symptoms. At all. So ukikuja kwa clinic hapo wanakupima, wanapata pressure yako iko juu. So it doesn't, like I told you, you don't need to have all these symptoms to be hypertensive. And how do we diagnose hypertension? Again, WHO wanasema if you take 3 separate readings, na zote out of the 3 you take an average of 2 readings, zinaonyesha pressure iko juu, chances are unaweza kuwa na nini? Na pressure. Tumeelewana? So ukuje kwa clinic leo upime, kesho ukuje upime, ama baadaye tena ukuje upime mara 3 and pressure yako iko juu, most likely you could be having pressure issues. Tumeelewana hadi hapo? Tuko pamoja? Tafadhali kama tuko pamoja uniambie. Tuko pamoja? Very good. So these are some of the clinical features of being hypertensive. It is a very broad topic, but sitaguzia yote. I'll just talk about what affects us mostly. Sawa. I won't dwell so much on how to test on whether kuna pressure ama. There are so many other investigations. Kama kuna test inaitwa ECG. Ile wanaweka vitu hapa, alafu kwa mashini unaona mashini yako ikifanya hivi. Umeshaiona hiyo kitu? Those are some of the investigations. But most importantly, what we consider mostly ni hiyo kitu tunaweka hapa. Umeona hiyo kitu? Hiyo tuliniwaambia tukianza. Yes. That thing. It has a very difficult name. Let me give you a challenge. Ukikumbuka, we will see each other later. Inaitwa sphygmomanometer. Tumepata hiyo? Sphygmomanometer. Tumepata? Tumepata? Sphygmomanometer. Tumepata? Yeah. That was a by the way. My class is awake. So, how do we treat this issue called pressure? Tumepatana, are we together up to that point? Tuko sawa? Very good. So how do we manage pressure? This is how we manage pressure. Number one, being a health class, it's all about diet. Sindo, it is a health Sabbath. We are privileged to have been told about New Start early in the morning. So, how do we manage pressure? Diet. Does that make sense? Very good. Diet. That is one of the options. Number two, New Start. Tunakumbuka New Start? Tunakumbuka? Si tuliandika mahali? New Start. Do we exercise? Do we exercise? How often do we exercise? Very important. Research has it, it's very essential to do your exercises early in the morning before you start any activity. Very essential. Hapo, you have a very smooth and calm day. Lakini wengi wetu including me, ikifika 6 hivi, kwanza unachungulia hivi, unaona hiyo saa, unasema ngoja tu 5 more minutes. 5 more minutes. Ukifungua macho hivi kidogo, it is 7 o'clock. You are supposed to be at work by 7:30. What do you do? Hata unasahau kukunywa maji. You go straight. But again, it's research. Early in the morning. Why? The evening workout is also good, but they say after the day's stress, sometimes you are not mentally fit. So early in the morning, unafanya tu exercise kidogo, shower, start your work. Anyway, point, very important to do what? To exercise. Number two, let's avoid the unnecessary environmental pollution. Like I told you, you don't need to be a smoker to be an active smoker. You can still be a passive. We have to be in a fresh environment. Yani, the serenity is awesome. Unfortunately, in the urban centers, our environment is polluted. Mungu atatuchunga, si ndio? But point is, we avoid polluted environments. We avoid smoking. We avoid alcohol, indulging into drugs. Sawa sawa. Number 3, let's avoid unnecessary drugs. Things like Brufen. Na wangapi wanajua Brufen? Hey, tunajua. So Brufen can actually cause increased pressures. It can. Madawa zile dada yangu anatengeneza, aliwakataza, mtaki sikieni tafadhali. Hizo madawa, tuache chakula ina mafuta mingi, a lot of fats. Dada yangu Esther aliongea juu ya types of fat. There's the good fat and there's the bad fat. Tuachane na maneno ya bad fat. Tuachane maneno ya oily. Tukiwa, I remember when we were in school, I happened to be a captain in school. So all along, captains used to serve first. Wanapata top layer. Unajua top layer? Wangapi walikula top layer? We enjoyed top layer. So in our school, it was a custom. Captains have to serve first. Alafu kisha serve, ndo upate hiyo nguvu, ukuje uchape hao wengine wapange line vizuri ya kuchukua chakula. At the end of the day, that fat, it is not good. It is not good. Fat kidogo si mbaya. Fat, the excess fat we are talking about here is the bad fat. Tulikuwa tunaambiwa asubuhi. Fat ya kina Blue Band, ya kina ile kitu ingine inaitwaje? Hiyo na hiyo ingine, kuna ile ingine walisema. Hiyo pia. So, but a little bit of oil. It's enough. Your food doesn't need to be glowing for you to be satisfied. The food is good. Sindo? So a lot of fat we avoid. Number 3. Nini ingine ile tena tuna avoid in diet? Nini ile ingine tuna avoid in diet? Absolutely. Salt. Salt, when I talked about kidney issues, when you have pressure issues, the most affected organ in your body is the kidney. if your kidney fails, or if you have any problem with your kidneys, your pressure do what? They will always shoot. So even in the hospital setup, ukikuja uko na shida ya nini, ya pressure, wanafanyanga test ya nini kwanza? Ya kidneys. Not even your heart, your kidneys. If you have a kidney failure, you will definitely develop a heart failure. You will definitely develop sukari, ugonjwa wa sukari. Are we together? So, which organ do we need to be focused on mostly here? The kidneys. So, with too much salt, ile chumvi mingi tunaweka kwa chakula ndio ikuwe tamu. If anything, if I was to be asked, tukule chakula bila chumvi, especially for the aged. What this salt does, ikienda kwa mwili ikikuwa absorbed, yani ikichukuliwa kwa mwili ina send impulses kwamba kuna excess salt kwa nini? Kwa damu. As a result, we need to neutralize this salt. Tunaelewana? So, impulses are sent to the kidneys to do what? To reabsorb more water. And as a result, damu ipump faster, ikisafirisha nini? Iyo maji, they reabsorb maji so that we be in a dilute state. Tunaelewana hadi hapo? Now, do you see why salt contributes too much to increase pressure? The more salt we take, the more impulses are sent, the more blood is pumped faster kwa mwili mzima so that we neutralize the excess. Are we together? We'll talk about that salt aspect some other time. But those are some of the common causes. Some of the common causes that we need to avoid to prevent increased pressures. Tuko pamoja hadi hapo? So far so good. I think we have noted it is all about diet and lifestyle. Si tumenote hadi hapo? Diet and... Let me just mention something very brief concerning the medication aspects. Madawa dada yangu anatengeneza. So when we're managing pressure, we usually put you on certain medication. Tunakuanzishia madawa ndio at least we get to control your pressure. Sawa sawa. I will just mention, but remember our focus is on diet and lifestyle changes. Diet and lifestyle changes. Sawa sawa. So we have couple of medication, couple of dawas sister yangu anatengeneza that help in reducing pressures. And most of these dawas work on the kidneys and the heart. You see, the most sensitive organs ndo madawa zinaenda kuchezea. Are you seeing the irony behind it? So what can we do about it? We just respect the diet treatment, the diet aspect and lifestyle changes so that we don't have all these complications. Sawa sawa. So we have a certain group of medication, again, like I've told you, that are focused on the kidneys and the heart. I won't give you the names. For now, let's just know they are there. Sawa sawa. If you have a question, you'll ask me about them, then takwambia. Tuko pamoja? How many are satisfied up to that point? Okay, good, good. Like I told you, if our pressure is not well controlled, we tend to have different complications. Kama heart failure, kama kidney failures, kama stroke. Wangapi wanajua stroke? Most of us know stroke. Stroke, it's a condition whereby one part of the body iko kama cabbage. Unajua cabbage? Iko tu. That is stroke, where one side of our body is paralyzed. Paralyzed inamaanisha haifanyi vizuri compared to the other. So these are some of the complications of high pressures. Wengine wanakuwa na shida ya macho. Shida ya macho kwa sababu ya increased pressures. Wengine wanakuwa na heart failure. You know what pressure does to your heart? There's there's a pair of the heart inaitwa left ventricle. It's just a pair. Ile ina pump damu kwenda kwa mwili mzima. Pressure ikikuwa juu inafanya kazi mingi. Ikiendelea kufanya kazi mingi, hata muscles za heart zinafanya nini? Zina increase in size. Kwa sababu imezoea kufanya nini? Kufanya kazi mingi. As a result, you develop what we call hypertensive heart disease. Tuko pamoja? It's still heart failure, but courtesy of pressure. Tumeelewa? These are some of the complications. Zingine nizo zote nimewambia basically. Those are the most common. Then we've spoken about hypertension. Now, I would be unfair if we close this session if we don't speak of hypotension, the opposite of hypertension. Hypotension ni wakati pressure inafanya nini? It is not very common. It is not very common. But brothers and sisters, you should be worried if your pressure goes low than going high. Tuko pamoja? Hypotension is when your pressures, basically it doesn't have a definitive figure, but is when your pressures go below the normal. This one can be detrimental. Hii itakumaliza haraka. Sawa. So that was just a mention. It's just a note. Sawa. Any questions so far? Yes. Haita kupata.
High pressure ukiwa nayo inaweza leta magonjwa mengine kama ya sukari. Si ni sawa umesema hivyo. Sasa nitatibu gani katika hiyo mbili? Kwa maana sasa naweza kwenda pressure ionekane. Sasa huko kesho niko na sukari, sasa niende pale pengine ambayo sukari. Sasa nitatibiwa gani?
Unatibu gani? Very good. Thank you very much. Now, ngoja tu kidogo nitakujibu. But he's brought a very important subject. A subject I want us to talk about very briefly. Sukari. Wangapi wanajua sukari? Sote tunajua sukari, si ndio? Si tunajua sukari? Sukari ni nini? I'm answering your question. Sawa. Ndakujibu tu. Wacha tuzingatie maneno ya sukari haraka. Sukari ni nini? Mtutu yoyote, sukari. Mtutu yoyote. Ili ngumu kidogo. Yes.
Mwili imekuwa iko na sukari mingi.
Mwili imekuwa ina sukari mingi.
Na ikiwa na sukari mingi unakuwa mgonjwa. Haya, saa zingine sukari imekosa kwa mwili.
That's an awesome answer. Sukari, to have high sugars in the body, it's not a good thing. Kweli. And again, when you have high sugars in the body na imeendelea kukua juu, you know, like right now we've just had our lunch. It's less than 2 hours ago. Tukipima sukari, I guarantee you zitakuwa juu. Kweli uongo? But now the body has a way of correcting these excess sugars. Sawa. I will introduce to you majina ngumu kidogo tu, but you will bear with me. There is something in the body called pancreas. Nani wanaijua pancreas? There is an organ kwa mwili inaitwa pancreas. Wangapi wanaijua? Sijui jina yake ya Kiswahili. Mtanisaidia tafadhali. Mtanisaidia. Anyway, this pancreas huwa inatoa vitu vingine hapa tunaviita hormones. Sawa sawa. Some of these, kuna moja, what we will focus on mostly, inaitwa insulin. Wangapi washaisikia hiyo jina? Insulin. Now, there is this guy called insulin. This guy is responsible in correcting the excess sugars kwa mwili. Tunaelewana hadi hapo? So hata sasa tumekula, sukari iko juu. Kweli? Sasa huyu jamaa ametumwa kwa mwili kufanya nini? Kucorrect hizo sukari. Sawa sawa. Tumeelewana hadi hapo? I want us to understand how the word diabetes came into. Sawa sawa. When we say someone akona shida ya sukari, inamaanisha hata baada ya hiyo masaa ya huyo jamaa anaitwa insulin kucorrect sukari, bado sukari yako inafanya nini? Another term I'm going to introduce to you. It's a term called chronicity, yani chronic. Chronic means kitu imekuwa kwa muda. Unanielewa? Kitu imekuwa kwa nini? Kwa muda. Now, it brings us to our definition of what sukari is. When we say you have sukari, when we say you have sugar, when you say you have diabetes, is when you have a chronic increased sugars. Situmelewa chronic inamaanisha nini? Situmelewa increased sugars inamaanisha nini? Chronic increased sugar secondary to these two things. Number one, it's either this guy called insulin is not working due to so many factors we will discuss, ama this guy insulin is there lakini hajafanya nini? Hayuko enough. You understand? Tuko pamoja? Insulin corrects our sugars. But when we don't have enough insulin, sugars inafanya nini? Hazikui corrected. We could be having enough insulin in the body, but still our sugars are doing what? Are high. Brings us to the types of sukari. There are basically how many types? These are the most common. But in real sense, there are about 5 types of diabetes. The most common we'll discuss about right now, it's type 1 and type 2. Sawa sawa. Type 1 diabetes mostly iko kwa nini? Kwa watoto, the young, huwa wanazaliwa nayo. They tend to grow with time knowing that hiyo ina affect wanani? Wadogo. How does this come about? Type 1 diabetes is when the insulin levels ziko nini? Kidogo. Tunaelewana? Why are they kidogo? It's because of jina. I want to introduce another term. Inaitwa autoimmunity. What does it mean? Autoimmunity in simple terms inamaanisha mwili yako inapigana na mwili. Yani it's a war. Inajipiga. Anything, unaelewa kitu hapo kidogo? Meaning your body is fighting your organs. Tunaelewa? So when your immune system is eating up that thing I told you called the pancreas, is where the insulin is being secreted. So when your immune system is fighting the pancreas, at the end of the day, we have reduced insulin levels. So for these people to do well, they have to have insulin kwa mwili. Sawa sawa. In other words, the type 1 diabetes inaitwa insulin dependent diabetes. Tunaelewana kwamba huyu lazima akuwe na insulin ndio sukari yake ifanye nini? Kwa nini insulin yake iko chini? It's because of autoimmunity. Kwamba mwili inafanya nini? Inapigana na hiyo pancreas. Ndio maana insulin haifanyi nini? Remember, we are talking about lifestyle. Now, this type 2 is where I want us to focus mostly on. Type 2 diabetes is when there is increased sugars in the system, there is insulin being secreted, but this insulin, haifanyi nini? Is not converting this sugar into stored process. Tunaelewana? Hapa tuko na sukari iko juu, tuko na insulin. Inafaa kufanya kazi yake, lakini ifanyi nini? Haifanyi. This is type 2 diabetes. That one it's easy to control. FYI, for your information, you can easily treat type 2 diabetes than type 1. Tunaelewana? Why am I saying that? Some of the causes, okay, the type 2 is what now we refer to non-insulin dependent diabetes. You remember ile ya kwanza ilikuwa insulin dependent, yani inategemea insulin kufanya nini? Kucorrect sugars. Hii type 2 ni non-insulin dependent, meaning hizi sukari zinaweza kakuwa controlled minus the insulin, meaning tuko na insulin enough kwa nini? Kwa mwili. Tuko pamoja. Now, what are some of, why do we have insulin in the body but it is not converting the excess glucose kwa mwili? Again, brings us to our discussion, lifestyle diseases, lifestyle conditions. What are some of the causes? Obesity. Are we together? Obesity. What does obesity does? When we have increased fats, because obesity is all about fats, they tend to impair, kuna viungo vya mwili ambapo huyu insulin anaenda anashikwa ndo anapelekwa mahali sukari iko juu, ana convert. Now, hivi viungo where the insulin is supposed to attach to, because of the excess fats, because of other issues I'll tell you about, these factors, these recepting binders, hizi vitu zinashikia insulin, hazifanyi kazi. Tunaelewana? We have insulin, they are supposed to be taken somewhere, but this transporting media haifanyi nini? Basi iko hapa nje, inafaa itubebe itupeleke town kuna shida, tuende tukasaidia hiyo shida, lakini hizi basi hakuna, ama kama ziko hazibebi. Si shida huko town itaendelea kuongezeka. The shida in town is the excess sugars. The basi is the transporting media kwa mwili. Then insulin ni sisi hapa, we want to go and help, lakini basi zimekataa kufanya nini? Kwa nini basi zimekataa kufanya? Labda imevunjika mguu, labda haina mafuta, labda dereva sijui amefanya nini, labda sijui makanga amefanya nini, labda sijui. You see, there are so many reasons mbona basi iwezi tubeba. It is the same principle. Sawa. We have too much sugars. Basi, which are the transporting binders in the blood, hazifanyi nini? Hazifanyi kazi. What are some of the causes? Tumesema fats, excess fats. Hizo fats zinafanya nini? Instead zinaharibu basi, zinajaza basi sasa iendi. Tuko na watu basi inafaa kubeba, lakini haiwezi beba kwa sababu kuna nini? Haiwezi enda kwa sababu ya fats, excess fats. What do the excess fats do? They impair the transportation. So for the insulin to get into the bus, the insulin to bind onto those receptors called buses cannot be. So at the end of the day, the sugars inaendelea kufanya nini? Point number 1. Point number 2, lifestyle diseases. Excess smoking, alcohol. Hizo vitu tuliongea kwa pressure, si tunazikumbuka? Excess salt. These are some of the causes that do what? That contribute to type 2 diabetes. Pressure inakuja. Again, I just want us to understand, we won't get into the pathophysiology of diabetes. Increased pressure will increase to diabetes. How? Hiyo basi inaenda tu ikienda hata kabla tufanye nini? Tuingie. Unaona? Tunakuwa na nini? Na sukari bado iko juu. Tunaelewana? These are some of the causes yenye tuliongea kwa hypertension that contribute to diabetes. Tuko pamoja? Tafadhali nisimamishe kama unielewi. Are we together? Are we together? Very good. So, how do we know we have increased sugars? There are certain values we check. When we talk of increased sugars, when your values, I will use grams per deciliter. My sister, huko mahali wanaishi, they use millimoles and other parameters. But for us, we'll use grams per deciliter. So you'll come to my clinic or to any hospital, tutapima sukari yako, tutakuuliza kama umekula the past 2 hours, ama umekuja tu random, tupime sukari yako. If your values are above 200 milligrams per deciliter in random blood sugar, ile nimekushika hivi elda nimekuambia wacha nipime sukari yako, and they are above 200, we will put you in that high risk level. Like chances are you could be diabetic. Tuko pamoja? That is with the random blood sugar above 200 milligrams per deciliter. If your sugars are at 126 milligrams per deciliter in fasting. Fasting inamaanisha umeamka tu hivi, hujakula kitu, umeamka, tuchukue sukari yako, tupate ziko above, then we qualify you. Sawa sawa. Note, we've taken 2 samples. There is random and there is fasting. Random ni ile wakati nimekupata tu kwa barabara, nimekushika. Bearing in fact probably you've eaten somewhere. Tupime sukari yako tupate iko hivyo juu. Sawa sawa. Na fasting preferably ni ile asubuhi mapema. Tumeelewana? And again another thing. These values are subject to change. It depends with the lab. There are different labs zitakupatia different values. Wengine wanasema sugars above 6.5 millimoles. Sorry, hizi nimeconvert into millimoles, not grams per deciliter. Sugars above 6.5 is increased sugars. Wengine wanasema sugars above 7 is again, it's subject to lab. But baseline is, if your sugar levels are above the normal values, chances are unaweza kuwa na shida ya nini? Sukari. Tuko pamoja? Now, before then, you will start having signs and symptoms. Signs and symptoms. What are the major signs and symptoms ya kujua uko na sukari? We have a triage. Triage inamaanisha vitu ngapi? 3. There is what we call kuna ile kunywa maji sana. You are always thirsty. Yani unakunywa maji, unataka kunywa maji sana. That is 1. Number 2, kuna ile you want to eat kila saa, yani tu una njaa. And the 3rd one, unataka ku excrete, unataka ku urinate all the time. Those are some, yani kila saa unakimbia choo kwenda ku urinate, kimbia choo kwenda ku urinate. These are it's called a triage. Medically tunasema polyphagia, kukula sana, polyuria, kwenda choo sana, na polydipsia, your excess thirst. Unakunywa maji but haifanyi nini? How do this come about? This come about because the high concentration of sugars will make you thirst. You will want to drink water oftenly to quench the thirst because of increased sugars. And as a result, you'll want to do what? Visit the toilets oftenly. And with that, because of that too much exercise up and down, you will be thirsting for food. Tuko pamoja? So it is a sequence. Sawa sawa. So that's the trio for our diabetic signs and symptoms. There are other symptoms. Another sign, you have others complain of headache, wengine waoni vizuri, vision blurriness, tunaelewana. Others complain of tumbo inauma, and the specific abdominal pain ni hapa juu, what we call epigastric pain, hapa juu, tumbo inauma, wengine there is excess sweating, wengine fatigue, unachoka tu. Yani, I'm just tired. Why am I tired? I'm just tired. Yani, you feel lazy. You don't want to do anything. These are some of the signs and symptoms. Excessive headaches. Wengine there is nausea and vomit. Unajua nausea? Ile kusikia kutapika na kutapika zote mbili. Unasikia kutapika alafu unatapika. These are some of the causes. These are some of the signs. Again, they are all because of increased sugars. Tuko pamoja? Are we together? Wale wanaandika, tafadhali niambie, rudia hapo tafadhali Mr. Boss. Hatujapata kitu. Sawa sawa? Wale tunaandika, I hope we are getting something. Sindio? Very good. So those are some of the clinical features of having high sugars. So, how do we manage this problem? Remember, we discussed type 1. Tukisema it is insulin dependent. So here, there's no doubt. You have to do what? You have to live on insulin. Tumekubaliana hapo? This type 2 is non-insulin dependent. And we found most of the causes ni nini? Lifestyle. Tuna remember zile issues tuliongea juu ya hypertension? Are the same reasons we are supposed to avoid. Exercise, tunakumbuka New Start, nutrition, exercise, water, blah 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 blah, rest. Tunakumbuka. These are the same thing we control our sugars with. If you feel you are a bit umenenepa kidogo, you exercise so that we create room kwa hizi basi zikubali nini? Zitukubali, tuende tukafanya, zikubali insulin, zika control nini? Sugars. If you've been exposed to environmental pollution, you try and avoid. If you've been indulging into drugs, we do what? We avoid. Sawa sawa? Are we together up to that? Are we together? Thank you very much. These are some of the causes. This is sugars. Sawa sawa? Before I close up, let me just briefly speak about, again, I'll just mention something concerning diabetes in pregnancy. Kwa wamama wajawazito. There is diabetes in pregnancy as well. This occurs in our mama, isi ya wanaume, so wanaume internalize what we have discussed meanwhile. So you get diabetes during pregnancy. Okay? Usually it comes, there's a lot of research on why do people get diabetes during pregnancy. Others say it's because of the placenta, blah blah blah. Again, men, this is not for you. Sawa sawa. So this diabetes in pregnancy usually resolves after 6 weeks of delivery, after delivery. Tuko pamoja? But the reason why I decided to mention diabetes in pregnancy, it's because sometimes after these 6 weeks, haitibiki, haipotei, then you develop diabetes type 2. Tunaelewana? So, diabetes in pregnancy is also a risk factor for diabetes type 2. Tuko pamoja? Tumeelewana? Yes, that is the reason why I decided to bring this up. Other risk factors include age, above 45 years of age, hypertension, sawa sawa. Others, use of contraception in our ladies, use of combined oral contraception, very specific, sawa sawa. This can also contribute to diabetes, sawa sawa. Tumechoka? Too much information, Nimeomba msamaha. So, by the way, nimemaliza. I just want to answer his question. Then I welcome any other question. Yes, goja to 1 minute. Let me answer his question. Now, when you have both diabetes and pressure, we don't treat one, we leave the other. We treat both. It is very, you see, ukikuja kwa clinic, uko na pressure na uko na sukari, hatutajua gani ilianza mbele ya ingine. Unaona, we treat both. So we put you on medication for both. Kwa hivyo ni madawa unakunywa hadi unakunywa. Madawa lazima itakuwa mingi. Madawa itakuwa mingi. So we treat both. We don't treat only one. Tukiacha moja, hii ingine itaongezeka. So lazima tufanye nini? On top of that, your health care provider will encourage you to continue with your daily exercise, environmental changes, basically just lifestyle changes. Sawa sawa. Thank you very much for having me here and listening to me. Those who listen to me, I will just take a few questions. Sindio? Yes. Saidia hiyo kitu ya mdomo tafadhali.
Asking?
Yes, please.
Kidonda ya mwenye akona sukari kina take long to heal than mwenye hana. What happens?
Kidonda ya mwenye akona
ugonjwa wa kisukari.
Wa sukari. Very good question. Haya. Now, you see, when you have increased sugars, let me introduce another term. There's what we call immunosuppression. Immunosuppression inamaanisha mwili ile hali yake ya kawaida inalegea. Inalegea kwa sababu gani? There is a certain substance in the body inaifanya inakuwa nini? Inalegea. It's like ukibeba like Steve here. Nipatie Steve at 150 kilos of whatever it is abebe, analegea. I'm suppressing him. At the end of the day, atafanya nini? Wataenda chini. Now, when you talk about immunosuppression, it means the body has an excess burden. Sawa sawa. So this burden in this context tunaongea ni nini? Sukari. So when you talk about immunosuppression, we say you are immunocompromised or immunosuppressed because of the high sugars. As a result of immunosuppression, there are certain viungo vya mwili vinasaidia kwa uponyaji, kwa sababu ya hiki kisukari havifanyi nini? Havitafanya. Unanielewa? Now as a result, hata vidonda uko nazo havifanyi nini? Haviponi kwa haraka. Note, it's not like this viungo za mwili haziko. They are actually there. But okay, 1 minute. But the fact that you are in an immunosuppressive state, zinafanya nini? They are killed because of the excess sugar. Unajua sukari mingi na choma. Do you know that? Too much sugar in the body, it actually burns your vessels. So when you're having sugar, when you diabetes, when you are hypertensive, we say you are at a high risk. High risk, the reason being you are immunosuppressed. You are immunocompromised. Unanielewa? Yani immunity yako, it's not the baby healthy immunity because it has an excess burden. I don't know whether nimekujibu. Thank you very much. There was a question there. Okay, ameniogopa. Another one, please. Yes. Two? Inakuwa chini. Okay. Now, all right. Now, when we say your immunity is low, especially for the, remember when we talked about risk factors, we said age is a risk factor. And actually, for your information, age is a risk factor for so many things, so many disorders. Not only the lifestyle disorders we have, diseases. Si pressure na sukari peke yake. Age is a risk factor for so many other things. Sawa sawa. Why? As you continue to age, unakuwa na immunity kama ya mtoto mdogo. Ngoja nikwambie. So, your immunity starts aging. Unaona? You are predisposed to, hata homa itakuweka chini. Utakaa tu kwa kitanda ulale. Yule mtoto mdogo, immunity yake iko very low. That's why a child, a newborn's immunity is dependent on who? The mother. The mother's breast milk. An aged person, wewe immunity yako ni kama ya mtoto. It is low. The only difference here is your immunity haikui supported. Imeisha, yani tu meaning with age viungo vinafanya nini? Vinalegea. There's badala ya kuendelea kukua stronger vinafanya nini? Again, this all came because of what? Sin. Remember our topic today is? Yes. So, your immunity does what? Your immunity grows weaker and weaker every day. Therefore, the aged are compromised when they are exposed to certain illnesses, when they are exposed to C19, when they are exposed to homa, flu. By the way, flu is not the same as cold. However, let's use that for now. When they're exposed to flu, when they're exposed to cold, their immunity is compromised. They can easily do what? Go down. However, this body here is not textbook read. There are those who do so well despite their compromised immunity. But then there are those who don't do well despite the same immunity. Sawa sawa. So, haimaanishi ukiendelea kuzeeka, ukipatwa na C19 ama upatwe na ugonjwa yote, utafanya nini? But baseline is immunity yako imefanya nini? Imelegea. Umeelewa? The reason why unaambiwa ukae huko kwa nyumbani, ukalime, ukakae, it's because if you are exposed to certain illnesses, chances of you going down are higher compared to an active person, a middle-aged and a younger person. The reason being, during this period, your system is active. Your metabolism is high. Ukiendelea kuzeeka, vitu tu zinaenda nini? It's like a graph. Unaona ile graph unachora? Hapo uko zero age. Inaendanga hivi. Unaona? Unaona hiyo mkono? Huku approximately tuseme Mungu akubariki sana 80 years. Hapo uko kama ya huyu hapa. You see? So the active age group ni iko hapa katikati. Umenielewa? Yes, that is the reason. Any other question? Yes.
Happy Sabbath.
Happy Sabbath.
Yeah, uja explain kabisa kuhusu hypotension.
Sija explain kabisa kuhusu hypertension.
Hypotension.
Oh, hypotension. All right. Okay, sawa. You are very right. Very right. I didn't want to focus mostly on hypotension because we don't get hypotension oftenly. most of the time we get hypotension, especially inakuanga kwa hospitali. How do we get hypotension? Now, like I told you, hypotension is when your pressures are lower than the normal. Okay, you remember our ranges. We had optimal, we had normal, blah, 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 kwenda juu. Now, when your pressures are going down, again, there is a range when we talk of hypotension. Sawa sawa. Between 100 and 120 of systole is the range. Iko hapo katikati. You are just at the edge. Anything below 100 in systolic and anything below 60 in diastolic. Note, anything below 100 in systolic and 60, below 60 in diastolic, you are qualified to be hypotensive. Yani pressure yako inafanya nini? And note again, this is always reviewed. These figures are always reviewed, but those are the WHO current guidelines. When you have hypotension, some of the causes of hypotension are illnesses. Ugonjwa yoyote, hata homa can cause you hypotensive. But when you talk about illnesses, we talk about easy mugonjwa, yani like, now which one? I won't use the word real. Like, let's talk about illnesses, like the real illnesses. Think of malaria, think of HIV, for example. Think of C19. C19 can cause hypotension. But some of these cases, you only get to see them wapi? Kwa hospitali. In a health, anyway, when you have hypotension, you are not healthy. One thing for sure. How will you know you are hypotensive? Number one, utasikia unalegea. You'll feel dizzy. Why will you feel dizzy? Because the blood supply to the body, the pressure imefanya nini? So the pressure that is supposed to keep us alert up here, inaenda chini, inaenda chini. So as a result, you feel weak. So you start feeling dizziness. You get? You start feeling weak, generalized weakness. You start sweating, some even sweat. You start feeling nausea. And all those symptoms. Sawa sawa. So, again, these are just some of the symptoms. But the most common risk factors for hypotension are just illnesses. Sawa sawa. There are rare conditions whereby there are people who are actually hypotensive and they are living so well. They are living so well. How? These people again get to be hypotensive with age. Unanielewa? As you continue aging, pressures zinafanya nini? Zinaenda chini. So the aged, wale wazee kabisa, some are hypotensive and they are doing so well because like I told my brother here, your immunity is already lacking. You know, when you have pressures of, let's say, 95/60/55, these very normal pressures kwa mtoto mdogo, this is absolutely normal. Again, you realize what is happening to the young is happening to the aged. Not again, it is not textbook. It is not textbook. The fact that you could be aged and you have those low pressures, which are okay, doesn't necessarily mean mwingine mwenye ako aged will have similar pressures. It's the body. How you respond to something is not what your neighbor will respond to, the same thing, because of just the system, the body. Sawa sawa. So, hypotension, those are some of the causes. Unfortunately, we were told not to say that to be a complication, but the end result for hypotension is death. So many people come back from. That's why we are so worried when you are hypotensive than hypertensive. When you are hypertensive, we can correct your pressures. When you are hypotensive, bringing those pressures from down there, it is not an easy task. Sawa sawa. So that's why I didn't want to focus so much on hypertension, because it's not so common unless in a hospital setup. And being in a hospital setup, you are predisposed or you have an underlying illness. Umenielewa? That is just something brief. Believe you me, it's a very deep topic. We will discuss that sometime, some other time. Sawa sawa. Yes, another thing, please. Probably the last question. Medicine ameniambia my time is up. Are we comfortable? Are we satisfied? All right. Once again, thank you very much for granting me this opportunity to stand here as tiny as I am and helping us discuss whatever is going on with our health. Remember, point to note today, being a health Sabbath, everything we've been talking about, everything we've been discussing the whole day, lifestyle, our bodies, this and that, is our bodies are the temple of who? So our only job is to taking care of what? Of our bodies. Sawa sawa. Thank you very much. May God bless you. We will close with a word of prayer. Then I'll invite Metrin to come over. All right, let's pray. Our kind and loving Master in heaven, we come to you once again, giving you thanks and glory for you've guided us throughout this session. We've come to the conclusion of it, and you've been with us, and we ask you to continue being with us. Whatever we've learned, whatever we've discussed, we want to ask you to help us put it into practice, into our daily routine. Help us continue keeping this body of ours holy, as it's your temple. Continue guiding us for the rest of the session, and if it's your will, let's make it again through the evening, which is in Jesus' name I pray and believe. Asanteni sana.